Okay, I think we are ready to go. So good afternoon to everyone, and welcome to this afternoon session on prostate cancer, family matters, blood, and bond. And I think you all are really going to enjoy this discussion this afternoon. First, let me just introduce myself. My name is Bill Whyte. I work for Janssen Pharmaceutica, which is a part of Johnson & Johnson. Janssen is helping to sponsor this event. I also happen to be a lifelong member of the great fraternity of Kappa Alpha Psi. 30 years, I'm a life member, and I'm very, very proud of our organization, not just for this session, but everything that we're doing throughout the day to really help drive awareness around some critical healthcare needs in the African American community. This is going to be a special session, and I think it's going to resonate well, particularly because we're talking about Black men and we're talking about Black men's health. And we've got a couple of great panelists here with us today to help us have a really, really rich and robust discussion, starting with Dr. Kevin Billups, who is a board certified urologist. Dr. Billups attended undergraduate school at the Harvard University, and I think went on to get his MD from the Johns Hopkins University in Baltimore, Maryland. So welcome, Dr. Billups, and thank you for being here, and is currently in private practice in Murfreesboro, Tennessee.
No, I'm actually a professor at Meharry.
At Meharry, okay,
Yeah.
I apologize. Right there in Nashville. I should know that. My sister went to Fisk, so absolutely. And then we have Robert Young, who is a patient advocate, was diagnosed with prostate cancer at the age of 47.
47,
and,
yes.
And is going to be here to share his story and really to share some key insights around why it's so important to get tested early, and to really have an advocate by your side. And as we can see, he has his beautiful wife alongside him. And I understand if you see Robert flinch a little bit, it's not that he's got itches or anything. It's probably his wife just kind of nudging him along, like we all need to have. So thank you so much for being here. And then Robert, of course, is also a member of Kappa Alpha Psi fraternity. So thank you, Robert, for being a part of this discussion and helping us out today. So with that, what I'd like to do is I'd like to turn it over to Dr. Billups, who is going to take us through a few slides to just articulate some of the clinical manifestations of prostate cancer. So Dr. Billups, over to you.
Okay, thank you, Bill. I have the first slide. So I just put a few slides together. I just wanted to orient us to what was going on, and then really I want to get to the conversation with Robert and Bill that I think will be very powerful. So my practice is really focused on men's health. So this is what I run through with most of the men that I see. So first of all, I think most of us know what the prostate is, but this slide really makes it easy to understand what the prostate is. So you see at the upper part of the slide there, that's your bladder. Then you have the prostate, and then you have the penis. So the urine has to flow from the bladder through the prostate gland and out through the penis. So there are a couple of things that actually go on with the prostate. There are two processes. We're going to talk a lot about prostate cancer today, which is extremely important. But there's also what's called benign enlargement of the prostate. So if you look at that right-hand slide on your screen, you'll see that when the tissue grows on the inside of the prostate like that, what it does is it squeezes off that urinary tube that we call the urethra. So this is when men, a lot of us, as we get older, we have trouble urinating. Things, your stream is slower. You maybe will leak a little bit before you get there. You have to get there right away. That's the inner side. That's called benign prostate enlargement. The only other point I want to make here is that one of the things that we're going to talk about is getting the rectal exam as well as getting a blood test called a PSA. But so if you look at the slide here, you see the rectum there. It's kind of on the first section. So that dreaded digital rectal that we all hate, I'm just going to show you why we have to do that, because we're really feeling for prostate size. So for size and cancer, we can't feel the inside of the prostate that is that common symptom of urinary obstruction, but when we do that, we're actually trying to see, well, what's the size of your prostate? And also, do we feel an abnormality that could be cancer? Because if we feel that, you need, then that is important. Let's go to the next slide. So I just wanted, again, this is another anatomy slide. I wanted to show you that you have the kidneys, the bladder, again, the prostate. So on the benign side, part of the reason you don't want to let these symptoms go, and so the benign prostate disease has urinary symptoms. Prostate cancer in its early stages, as we'll talk about, you don't have any symptoms. You have to go in and get checked. You have to go in and get the PSA blood test and get a rectal exam. But if you do have these symptoms, it can affect your bladder and your kidneys also. Next slide. This is the same thing. It's just an up close showing again the benign obstruction. So let's go to the next slide, because I want to go through these pretty quickly so we can get to this. So so you can have different symptoms with different chronic conditions. I talked a lot to the men in my practice about chronic conditions: diabetes, high blood pressure, heart disease. All of these can actually impact your urinary symptoms. But from a prostate cancer perspective, we're not going to focus on those today. Next slide. So prostate cancer, again, prostate cancer and PSA. What does PSA stand for? PSA stands for prostate-specific antigen. It is a protein that's secreted by the prostate. It is often elevated with prostate cancer, but it is not the perfect marker, because you can have an enlarged prostate, a very big prostate, and your PSA can be elevated. You can also have a prostate infection, or even more commonly, an inflammation. It's not a bacterial infection, but it's an inflammation that can raise your PSA. But PSA is still a useful marker, and it's actually it's most useful after prostate cancer, because if your prostate has been removed or been treated, then your PSA should be either 0 or it should be very low. So following yourself after prostate cancer, the PSA is very important. And so if you look at African American men, we have one of the highest incidents for prostate cancer. We're more than twice as likely to die from the disease. So that's a lot of why what we're going to focus on is early detection and what you can do to protect yourself. Next. So these are just some quick facts. About 1 in 7 men will develop prostate cancer. Most of the cases, 6 out of 10, are 65 and older. But one of the things we're going to talk about is you can't hang your hat on that. Prostate cancer occurs in younger men. And honestly, I can tell you from my clinical experience, in African American men, it can tend to occur earlier and it can be more aggressive. So that's a rule of thumb that the majorities occur in men age 65 and over. But as we're going to talk about a little bit further, you need to start being examined for this at age 40 if you're an African American man or family history. All right. Most men will diagnosed with prostate cancer do not die. Now that's one thing. And I'll just say one thing here. I've had African American men come into me and say, I'm not going to, I don't want to find out about prostate cancer because, I just don't want to know, and the side effects that we'll talk about are too bad. Well, the bottom line is this: being diagnosed is not a death sentence. We have very good treatments now. The thing is to catch this early. You're better off being proactive and catching something early than sticking your head in the sand and then just waiting until it's spread. And we'll talk about where it's spread to. So, okay, I've already said some of this. African American men about more than 1.5 times more likely to develop prostate cancer than white men, 2.5 times more likely to die from prostate cancer than white men, and less likely than white men to be offered the opportunity for PSA testing. So this is really, and I'm going to let Robert speak to this when we get to it, is you have to be your own advocate. I think in general in medicine you have to be your own advocate, but part of what we want to do today is educate you that if you're an African American man, I think at age 40 you should be getting an initial PSA screen. If you have a family history, you ought to start even younger. Next. These are just some factors. I think someone asked me, I saw something come through in the chat about diet, nutrition. So nutrition is actually very important. I can talk some more about that later, but a healthy diet is good for prostate health. It's good for not only prostate cancer, but overall prostate health, and I think on a preventive level. So being obesity, diabetes, high blood pressure, all of these things, having a good diet is good for your prostate. Now, the beauty of it is having a good diet is also good for your heart, your blood pressure, diabetes, and a lot of things. It's the same thing in terms of being good for your prostate. Next. Okay, I kind of mentioned this, and I'm giving you just a screening. African-American men, we need to be assessed starting at age 40, and as I said earlier, if you have a strong family history. Some people now are shying away from doing a digital rectal exam. As a urologist, I'm not going to shy away from it. If you come into my office and you're a man over 40, unless you flat out refuse, you're going to get the digital rectal as well as getting a PSA. I still think that there's some utility for me to know the size of your prostate. It helps me assess what the PSA really means, and then if I feel something abnormal. Next. So these are they're different, the idea of should you be screened or not. And I'm really just going to I'm going to focus on the American Urology Association's what the guidelines are, which are if you're younger than 40, the recommendation is that you should not be screened unless you're an African American man or a man with a family history of prostate cancer. Now, I say that last point because it gets left out a lot. So this is a big education piece that we want you all to walk away from with this age in terms of being screened. And so the age where they really recommend from our Urology Association is from 55 to 69, where you have more of a discussion with your physician about screening. African American men, different category, and so we in the National Medical Association, we really focus on this quite a bit. African Americans need to be assessed earlier, and I think that there's a general kind of education gap. I do a lot of prostate screenings over the years, from being a resident all the way to being an attending now, and I'm gonna tell you, it's hard to get Black men out. It really is hard to get Black men out, and I'll let Robert speak some more to that. Let's see, next slide. I think that's probably some of the treatment options. I want to go over this more as we talk. I'll just say for right now, there's a range of treatment options, and we can hit more of these in the discussion. There's active surveillance to kind of watch the prostate cancer, but actively watch it and do biopsies and things that we need to do. There's surgery, there's radiation therapy, there's cryotherapy or freezing the prostate, hormone therapy. But why don't we save this as we go through some of the discussion rather than me just kind of going through them, because it'll be in better context. I just put this last slide in because I wanted to show you, people always ask me, what happens if you have radical prostate surgery or prostate surgery for cancer? So on your left-hand side is the before. So you see that's the bladder, the prostate, and the penis, similar to what I showed you before. When you have prostate cancer and we do surgery, no matter what route we take, whether it's a laparoscopic or robotic or an open, in the end result is we remove the prostate. So we remove the prostate and then we reconnect the bladder to the urinary tube called the urethra so you can urinate. And we can discuss in more detail some of the things that men are concerned about, which is one, having erection problems after the surgery, and also having problems with urinary incontinence or leaking urine. But you see how the anatomy is different. When you are operating on for prostate cancer, we're removing the entire prostate. And I think that was my last slide, so we can kind of go back to the discussion. Oh, I already mentioned this, because I always get asked this question. What's a good diet for prostate cancer? And as I said, a good diet for prostate cancer, I believe I call it a plant-rich diet. Some people talk about a Mediterranean diet. I think a plant-rich diet. It's the same diet or lifestyle that's good for your heart, for diabetes, blood pressure, and everything else. So I'll stop there. Bill. I want to do that pretty quickly, okay. But I think that we'll hit all those points in the discussion.
Yeah, absolutely. Thank you, Dr. Billups. And we'll go back to some of the points that you made. I'm monitoring the chat, and we've already got a pretty lively group of questions coming in, so we'll go back to some of those. But right now, I want to turn it over to you, Brother Young, to just tell us about your journey. What made you talk to your doctor about prostate cancer? How'd that conversation go? And tell us a little bit about your journey and the importance of your caregiver.
Well, actually, my journey really wasn't prostate cancer related. Let me answer a couple of quick questions because I saw them pop up in the chat right quick, and I can get right back to it. Number one, if anybody who's asking about symptoms, if you're a person who's dealing with symptoms of prostate cancer, then you've already waited too late. So you're already in the problem stage. And secondly, I just want to tell everybody when I get through telling this story, you understand why you need to keep a copy of all your blood work records. Whenever you go to your doctor, you need to get a copy of your blood work and make sure you keep copies of that, just like you would have a bank account. But
Hey,
what happened with me,
Let me
actually, I
Robert,
injured my shoulder playing golf.
let me stop you real quick. When you said symptoms, if you're already having symptoms too late, that's powerful. What kind of symptoms specifically are you talking about?
Well, a lot of times people have incontinence problems or impotence problems. You may have blood in urine, blood in stool, those kind of things.
Got
Those kind of issues are what typically the biggest things that happen with a lot of people. A lot of times, if you're from rural places, like I'm from rural Alabama, Greene County, Alabama. So if you're from the old school, you remember you hear men say something like "my nature won't rise" or things like that. That's typically something going on in that area, but they never got it treated.
it.
And
Absolutely.
typically, those were the early signs of something going on in the prostate area, whether it was an enlarged prostate or whether it was a prostate cancer. That's what was going on. But those would be the early symptoms of the first symptoms of prostate cancer. But a lot of times when that occurs, the cancer is already spread outside of the prostate area, and then you have to go into a different level of treatment. But my story
Got
came because I injured my shoulder playing golf one weekend, and I was walking around with my head like this. And my wife and another frat brother of ours, his son that I used to work with, told me you need to get to the doctor to see what's wrong with your shoulder. Now, mind you, this had nothing to do with my prostate. But my doctor is one of those old school doctors that if you go in to get checked up, he's going to run a full check on you anyway. So he ran a full blood test, gave me something for my shoulder, and told me to come back in 2 weeks and see how my neck was doing. In the meantime, the blood work from um, my PSA count came back at a 6, and it had been a 4 the previous year. Now I mentioned that because it's important that's why I say it's important for you to know your blood work from the previous year, whether it's your blood sugar or your PSA or whatever. You can have that record to see if there's been any major change in any of your numbers on your blood work. Now I didn't know this at the time about the PSA, but my PSA had gone from a 4 to a 6 in 1 year, and that was a real light for my doctor. So he sent me directly to a urologist who ran the test and everything. I ended up having a biopsy. Once he did another PSA and a digital rectal, and then it came back, and I had to have a biopsy. And after the biopsy came back, I tested positive for prostate cancer. Now, my numbers at the time, and anybody wants to look this up, I had a Gleason score of 3 plus 4, which was a 7, which was at the early stages. Um, so I ended up at the time. Remember, I was 47 years old, and so you understand, I'm 47 years old. Daughter just graduated from high school. She's in college. My son's in high school, and I'm going, oh, what am I going to do now? So we went ahead discussed everything and to discuss various forms of treatment with our doctor. Um, and our doctor is a surgeon, by the way. He's a very proficient in the Da Vinci robotic surgery method. So, but he advocated that made sure that I got information on well, we got research on all types of treatments. So he sent us to the radiation doctor. He actually told us to go see the guy to talk about the radiation treatment, the seed implants, whole 9 yards. But the radiation, and this is when you know that that you're dealing with a good urologist, because I got to the after we got through the information with the radiologist, he looked at us and said, "Now I can do the CD therapy, I can do the radiation therapy based on your health and your quality and where you are health wise." The radiation doctor turned down my money and said, you should have. He recommended that I have the surgery because of um, of my condition where I was. So that's the first thing you have to look for. Make sure you have a doctor who's not just stuck on one type of treatment, because there are some urologists out there. If they're a radiation specialist, they're going to do radiation regardless of what's going on. If you have there are some surgeons out there, they're going to do surgery regardless. So just make sure
Right.
you have to be sure you're getting a good doctor to make sure you get this taken care of.
Right.
Um,
Hey,
the vi-
Robert, can I stop you? Can I stop you there? Because we
Sure.
got a couple of questions, and I want to catch one of these questions while we're on this topic. Dr. Billups, can you one, can you talk about surgical outcomes? We get a lot of questions about incontinence and impotence. And then number two, can you just touch on what is proton therapy?
So, okay, so in terms of surgical outcomes, there are several different ways that we can, you could do
Yeah.
open surgery, and I trained at Johns Hopkins. That was my chairman was named Dr. Patrick Walsh, and he really pioneered what's called the radical retropubic prostatectomy. So we did a lot of open surgery there. Now they do a lot of robotic surgery
Right.
with people coming along. Honestly, I think that you can get good outcomes with both of them. It really, to me, is this is where you have to do some homework, whether on yourself or knowing people. There, some surgeons they're outstanding on the Da Vinci robotic machine, and that's not an open incision, and those are supposed to be some of the benefits of it. But I know a lot of my colleagues at Hopkins, and again they do both there, but they can do the open surgery now through a very small incision. So to me, we can get fairly good outcomes. I tell men, here's what I tell men to be realistic. If you're having erectile dysfunction problem before you have any of the procedures, there's a very good chance you're gonna have them. So one of the best things every man can do is take good care of yourself. Because if you go in there and let's say you're overweight, you have diabetes, high blood pressure, one, you probably already have erectile dysfunction in some form. But if you don't, your chances are much higher than the healthier that you are going in. You can get incontinence with any of the procedures, but this is where you want to find a skilled surgeon. If someone's going to operate on me, I want them they're in the operating room 4 days a week doing these surgeries, day out to get the best outcomes. But the reality of it is, the the risk for incontinence, I think, has really decreased, especially with increased surgical skill. The erection issues are there. What I tell people is we can treat that problem. I actually prefer to see people before they have the surgery or any procedure, because whatever procedure you get for prostate cancer can lead to some erection problems or some of the other issues. So,
Okay. Thank you. Thank you. Robert, what role did your wife play in your decision about treatment and your overall care?
You want to
Well,
answer that?
I mean, for the most part, I let him, he was doing his homework. So I really didn't have to chime in to urge him to investigate, the different forms of treatment. He actually was very proactive with that. I just wanted to make sure that I was available to support him with going to the doctor to discuss whatever treatment it was. And I mean,
Okay.
and that's my thing is like, as a wife or as a partner, make sure that you are willing to support your spouse, and vice versa. The spouse needs to be willing to include the wife, because you can't, when you go to the doctor's office, this is overwhelming, and you can only digest so much information.
Mhm.
And so sometimes we still argue over what happened, because he hears one thing, I hear another. And then, finally, when we put our stories together, we come to some kind of, consensus about what really happened. And we do that because we have a son that's 32 years old now. So when Robert talks about keeping track of your numbers, you're keeping track of your numbers for yourself, but we're also keeping track of those numbers for our son. Because at about 37 years old, 10 years prior to when Robert was diagnosed, he needs to be checked. So I have already told him that whether the insurance pays for his procedure or not, he needs to be prepared to pay for that procedure. So it's
Mhm.
probably not going to be that much. It might be $100 or whatever, but you need to have the money available so that you can get checked at about
Yeah,
37 years old, because it's 10 years, I understand, prior to the
Mhm.
father being diagnosed. So those
yeah,
numbers will already be in place for him to see. His numbers now are point, what,
0.00001.
000. So
It
he'll be,
comes up
yeah,
negligible, so.
yeah. So over the last 16 years or so, he'll be able to see his progression of really point zero zero
mhm.
zero zero.
And,
So, which is
and
That's
see,
good.
and see, the good
that's
thing about it is
fantastic.
because I was diagnosed early enough and I was able to be treated at the point I was. I had, like I said, I had the robotic surgery, but I have not had to go back and have any subsequent radiation for anything because
Mhm.
everything was treated. Everything was picked up and done early. One of the things I think somebody asked about is the family history. One of the things we have to look at in the black community, and Dr. Billups and I talked about this the other day, is that it's really hard about family history in the black community because a lot of men were not going to get prostate cancer checked. A lot of men who have died from bone cancer is in a lot of cases that's probably untreated prostate cancer, because what happens once that cancer leaves the prostate area, the first area of attack is the bone. So once it gets into the bone, then you start getting into things like hormone therapy and just a lot of other different treatments that are a lot more difficult to recover from, and takes a lot of toll on your body.
Yeah,
So that's something we really don't address.
yeah, and that's a great point. Two questions, Dr. Billups. One is you recommend African Americans get screened sooner. Are there any implications of that, i.e., insurance companies perhaps being a little bit more resistant to paying for certain out-of-pocket costs? Anything you could comment on there? And
Sure.
then secondly, um, why is there such a strong link um, genealogy wise between men of color?
So okay, so I'll answer with the first question. If you look at the guidelines now, African American men should be screened at age 40 as a minimum. And actually, Mrs. Young described it perfectly. If that's African American, if you have a family history like their son, I think it should be 37, 35. I mean, so to me, is there a problem with insurance companies covering it? Age 40 should not be a problem. Now, there's somewhat of a gap out there, and sometimes providers will say, "Oh, you can wait till you're 50." That's not true. If you're an African American man, you should be screened at age 40. You may, but if it were me, I think if you're younger than age 40 with a family history, I think it's worthwhile going ahead and getting that test, because what you want, as Robert really outlined, is you want to see an increase. It's not just the absolute number. It can be an increase in velocity over time. So age 40 should not be a problem. That's in the guidelines.
And
And what
other
was the
thing to
second
keep in,
one? Oh, go ahead.
well, the other thing to keep in mind is that um, high PSA does not necessarily mean that there's prostate cancer, because you can.
Right.
But what you're doing when you go to your doctor, you're actually establishing a benchmark for yourself. My dad had a high PSA count, and there was a time my mom called me about him, and his PSA was 6 or 7. But when they did everything, he was clean. But at the same time, there have been people from my practice, the doctors who treated me, they had people who come in with PSAs of 2 or 3, but they did a digital rectal exam and found something that they didn't like, and they went in and did the biopsy, and lo and behold, there was like a stage 6 or 7, Gleason stage 6 or 7 prostate cancer. So you have to go in and establish your own baseline to make sure where you are before any determination can really be made.
Mhm.
And
Okay.
that's why you can't avoid that rectal exam either. Everybody wants to avoid the rectal exam. Well, you just can't.
It's like you
Yeah.
said, the doctors feel something sometimes, and it just doesn't feel right, and that's been the cure for some people also.
Yeah. Dr. Billups, just to elaborate on that point, because the DRE is so vital to you being able to assess the prostate, what would you, or what do you say to those men in your practice who are reluctant, hesitant to have that test done? I wonder if you could just share a little bit about how you
Sure.
might try to persuade them to think otherwise.
Well, what I tell them is that I can't give them, I can't do a complete evaluation. And that, yes, I can look at the blood test, but then it's important because one, I want to know what size your prostate is. So if your PSA number came back a little bit, that was higher than what I might think was normal. If you had a big prostate, that would make me think about it. Also, if you had inflammation or different things. So I try and give them the reasons why, why it's important, like what information I get. And I just tell, another thing I tell them is if it comes out good, it's once a year and you're done. I use that. What really is funny is when some of the men come in with their wives or significant others, and they look over at the woman, and they're like looking for a sympathetic ear, and she would just look at him and say, "I get a pelvic exam every time I go in. You better just man up and let doctor do what he needs to do." So I love it. I love it when the wives and the partners come in, because I know, and when they make that look, I'm like, "Yep, I got you now, buddy. There's no way you're getting out of it now." So anyway, you got to have a little fun with this stuff.
Okay.
Yeah, you really
Fantastic.
do. I mean, yeah.
I wanted to
Fantastic.
say something about active surveillance. When I was looking at the chart that you had, or the slide that you had, I thought about active surveillance does not mean ignoring it.
Right.
So when you
Yes.
do active surveillance, you do that under the care of a doctor. It doesn't
Yes.
mean you go to the doctor one time and you discuss active surveillance and then you just ignore it the rest of the time.
Yeah.
You'll be in trouble if you do that. And so,
It's a
like, if
protocol.
Robert had decided to take that avenue, he would not be here today.
Yeah.
I mean, it's been 16 or 17 years now. He would be very sick, or he would not be here
And doing proper active surveillance. I mean, a lot of people don't understand what that really means. That means a biopsy twice a year, you
Mhm.
know, because you want to keep those PSA and biopsy probably at least once every year, but sometimes twice a year, so the doctors can really see if that cancer has spread at all. My thing at 47, I'm thinking, everything else doesn't matter. I want to be around to see my kids graduate from college. I want to see grandchildren if they ever come, anything like that. But there are some things you have to make a choice about as far as life, and that was the real choice on my real basis of my choices on what we did.
today.
Right. That's awesome. Got a lot of questions about uh, dietary supplements. There's a lot of advertising for these prostate enhancing therapies. Dr. Billups, you want to comment on any of that?
Yeah, I mean, I'm not a big believer in supplements. I think the one thing that could be healthy for a prostate is zinc, and usually those come in like 50 milligram tablets a day, and that can help. It can help with prostate health, and it can help with a number of things. Instead of supplements, you know what we need to do? We need to eat a good diet, and I mean, and a plant-based or plant-rich. Now, the first thing I tell people, I'm not saying give up all your meat. I'm not going to be the meat police. I'm just saying you need to change the proportion of healthy vegetables that you eat to the meat and cut back on some of the meat. That, to me, you will get the supplements and the nutrients that you need. And I can tell you, we've had really some interesting stories with men, some of whom who've had prostate cancer, some of whom just had prostate enlargement, elevated PSAs, but they were eating the standard American diet, which is rich in fried foods and everything. When we switched them to a more plant-rich diet, and I don't say diet, it's a lifestyle. You have to make your mind with it's a lifestyle. The results have been unbelievable. You know, so honestly, I think that's the best thing every man, and especially African American men, could do for your prostate health. And if we can get the younger men and the teenagers to start doing that, I think we would, in a couple of generations, we would see a completely different picture.
Hey, Bill, I want Dr. Billups to just talk about this because there's a lot of misinformation out there, and my doctor and I have had, and doctors and I have had this conversation about the misleading information about out there about testosterone, about how that's out there, and you buy these supplements for that to do this and do that, and without understanding that you buy these supplements that it tends to affect how your body actually produces testosterone, and that makes an entirely different subject. So, can you just touch on that for a minute?
Sure. Well, actually, so you're hitting right in my sweet zone here because my men's health practices, I do a lot of sexual medicine, erectile dysfunction, low testosterone. I link it to chronic disease. So you're absolutely right about one of the first things I tell people is if I put you on testosterone, your testes are going to stop making it because your body says, I have testosterone, so we don't have to make any more. Now, for some men with the proper workup and evaluation, if they really aren't making testosterone and their levels are low, that could be part of a solution. But again, let's go back to this diet. What's the biggest thing I see in a lot of men that have low testosterone? They have what we call abdominal fat. So if you're a man and you measure your waist size, not your pants size, at the level of your belly button, it should be less than 40 inches. Actually, should be less than 37, but less than 40 is adequate. So that abdominal fat lowers your testosterone. It does a lot of things. So just because you have the symptoms of low testosterone doesn't mean the best therapy for you is to go run and take an injection or any of the other treatments. And if you have prostate cancer or at risk for prostate cancer, you really have to be careful. I think that's where you're probably going with this, was the fact that prostate cancer is a hormone sensitive cancer, right? So testosterone therapy does not give you prostate cancer. That's kind of the urban myth. Getting on testosterone doesn't give you. But here's the thing: if you go on testosterone replacement, if you have an undetected prostate cancer, your PSA will go up. And so that's the reason why we follow that. But so my two take-home messages for testosterone is don't fall into those. I call them shock clinics where it's a one size fits all, because it's not a one size fits all, and there's a lot of lifestyle and other things that you can do. If you're somebody who's a prostate cancer survivor like yourself, I do treat some men like that as an individual case, but you want to be monitored because like I said, if your PSA goes up on any kind of testosterone therapy, that could be an undetected prostate cancer. So.
Wonderful. Dr. Billups, I wonder if you can talk about the mental side of being detected with prostate cancer. In your practice, you treat the holistic man. Does that add a different level of complexity to treating men, specifically African American men? Because again, mental health is not something that that we talk as much about as we should. I wonder if you can comment on that dynamic, and then, Brother Young, I would love to hear your thoughts on that.
Yeah, I love to hear what Robert says too. I'll give you my impression. So I pick up a lot of depression or depressed mood, chronic stress, chronic anxiety. It's huge. I mean, it's a lot of African American men, a lot of all men, but African American men have that. We are very hesitant to go and get therapy. There's kind of a stigma around that. So part of what I try and do is one, I try and reassure people, but then the other thing is I try and find really good either clinical psychologists or psychiatrists who I can refer to, but who really understand the whole idea, about this is an important component of medical disease, because you can be depressed or chronically stressed and anxious, and it's eventually going to manifest as some sort of medical problem. So very common problem. I'd say it's difficult to kind of get Black men to act on it, but I think that is changing, and you really just have to spend a little bit of time with the guys and just say, I'm gonna look at the medical side, but there are obvious other factors here. So I'd be interested, too, with Robert, what because you must have had some of that when you got diagnosed.
May I say something first?
Sure.
Absolutely.
Okay. Well, I wanted to say, and I've been sitting here thinking about, one of the things that we did was to join a support group. And it really, like, once you start paying attention to what's going on with your body, keeping track of those numbers, you get more interested in what's going on with you. And you get better at, looking at, am I depressed? And being honest about that. And but there are many ways to tackle the problem. And so one of the ways we tackled it is by going to a support group. We go every month, except for the
Since COVID, yeah.
the pandemic, we couldn't go, but we did it online still. But yeah, that's just one way you're around, a group of people that have had similar situations, and you talk about it, and you continue to learn more about, prostate cancer and all of the new treatments that are available. And it just makes you more interested overall about your just overall health.
Just from my standpoint, I mean, initially, and I went through some things. Initially, I was just happy that initially when Dr. Billups came in and said they got it all, the lymph nodes were clear and everything, I was happy. But then you go through these phases for a while. You're trying to regain your, just be able to go to the bathroom without leaking, or just walk around without having that issue. And then you do have the sexual problem that does come into play. So all of that does come into play, and you do start thinking about those kind of things. You have to really gear yourself to say, yeah, but they saved my life, and you have to go into that kind of
Mhm.
mentality. But then you start worrying about, your wife and everybody else, and trying to get everything going, and so it does kind of create a barrier for you. It's a fight that you, as back then, like you said, Dr. Billups, we don't go seek help, we don't go talk to anybody. Um, and it does kind of, it will kind of eat you up if you let it. So, but there is a mental aspect to it.
Yeah,
Yeah.
and we weren't
Yeah.
created to live this life by ourselves. There's so many people, that can help us. And so we just need to take advantage of that. People love you, and people who are qualified to take care of you.
But the main
Yeah.
thing
That's
about prostate cancer is that it's not anything that we have to understand. It's not anything that we have to die from, or we really have to,
Mhm.
just get out of shape about. The main thing is going to your doctor. And most people, the sad part about it is that a lot of people who are getting diagnosed at a late stage are people who work for major corporations, who have great insurance plans, who will pay for the test, but the people just don't get it. And that's the real sad part about it.
yeah.
Just one story I want to tell, just so you understand. Though, after I was diagnosed, I've been running, I've been a clinic at my church, and there was a gentleman about 10 years older than I was at the time, who had never really been tested. He was a prominent member of the community, but he was tested. We did a screening at our church, and he was tested, and turns out that he came out positive for prostate cancer, but he was beyond, he was after that stage, and everything had already. I think when they diagnosed him, he was already like at a stage 3. So they tried all they kept him alive pretty much as long as they could. They gave him the hormone treatments. They did everything with him and kept him as long as they could. But his wife actually gave me permission to use his name after he passed to tell his story to other people, so they'll get tested. I've been fortunate enough now that people will come ask us because we told the whole church after it was done, say, hey, I'm good. So have any questions? So there are people who will actually come to us and ask us once they've been diagnosed. Some of these gentlemen still won't come out and stand up and tell that's what they went through, but I know people who have asked us for advice and come back and thanked us because we told our story.
Mhm.
That's wonderful. And I guess that kind of brings us to uh, another part of our discussion, and that is, what can we do to help alleviate the stigma? I mean, certainly forums like this help, but I'm curious, Dr. Billups, if you have thoughts, and then, Mr. and Mrs. Young, are there other things that our fraternity, other organizations should be doing? Is this something that Black men need to own in a different way than we do right now? Curious about your thoughts around how we decrease this stigma.
Yeah, that's a tough question. It's a good question too, because you're right. There's something about trying to get Black men to come in and if it's for a prostate cancer screening. So I've tried a couple of things. One is, I think education is huge. I think forums like this, where you have not only a physician or provider, but you also have somebody like Robert and his wife. I mean, that speaks to people. People listen, and when people get educated, they'll get engaged, they become empowered, and empowered people are the ones that act. The other thing that I think we do, what I try and do is, because there's just kind of some of the stigma around prostate cancer and things, I try and broaden it into a men's health evaluation. Because if you're coming into me and I'm going to, for PSA and prostate, I'm going to check everything else, because I mean, Lord knows I get a man in the office. We're going to look at your blood pressure, your cholesterol, and everything like of that too. Also, maybe that just kind of widens the umbrella, and I also just let people know that just like Robert, and it's been said a number of times, one, this can be prevented, and doing nothing is not a good way to go. So I think education, talking, these kind of forums, and I think are very important to get the word out to people.
I think we need one of the ways that'll help this and get the word out is talk to the sisters about it a little bit more, because
That's good.
they'll kick the brothers out
That's right.
to do what they need to do. But that's one. So I think one of the things, we're doing this at our forum nationally, and naturally with the capitals, but I think at some point, if people do like prostate cancer forums at the AKAs or the doctors or any of those kind of groups, that might push more people to be tested, because that's just the way it is. I mean, we do a lot of things because our wives tell us to.
Yeah, that's a great point. I
Yeah,
100% agree. I 100%
no,
agree with
listen, you want
that.
something done, let's get the women involved.
Yeah.
You don't have any reservation for me on that one. Absolutely.
Look, I
Absolutely.
saw
Yeah,
I
just
saw one question pop up. Somebody was asking about a 75-year-old being treated, and what would they recommend? The cyber knife or what
I saw
treatment?
that
I
question.
said any treatment is going to be an individual based on what you want to go through. But also, you doctors, and I'm not sure how Dr. Billups is about this, but at 75 years old, you may really want to evaluate where you are, with the cancer and everything else. And I'll let Dr. Billups speak to that.
Well, yeah. So for a 75-year-old, I certainly would look at a number of options. I also would take into account, what the overall health picture is. But nowadays, people staying healthy. I've had some people that were extremely healthy, 75 to 70-year-olds. Would I say no to a surgery? And I don't do the surgeries anymore. I see the other side of the surgery, but I certainly know quite a bit about it. So I agree with you. I would look at all the options. Now, chances are at that age, you're probably gonna look at it, something else besides a surgery, radiation, other things like that. But I look at the overall health picture too. I think you have to look at that too. So
Just to give a brief thing about surgery. Now, one thing I think people like with robotic surgery, I went in the hospital at 6 o'clock on a Monday morning, and I was at home at 2 o'clock Tuesday afternoon. So it's not a lengthy stage. Most of your initial recovery is going to be done at home. After the second day, you just have the catheter and a few other things to worry about. Like I spoke about earlier, the leakage, the incontinence. But that's the one thing I have about the Da Vinci method. And like I say, I prefer it. I speak highly of it, but I know people who've had seed treatment who've been very happy. So it's the choice of treatment is up to you. The best thing about having a choice of treatment is detecting it early enough so you can have those choices. Because if you wait too late, then you eliminate things like the robotic surgery and the radiation, because the surgeons don't like to go back in after you've done a radiation treatment, whether you did
right.
a seed or any type of radiation, because what people don't understand is that even the radiation leaves scar tissue in the area. So if you do the radiation and then you have a recurrence of the prostate cancer, then the doctors have to try to work around the scar tissue that's been created by the radiation.
Yeah.
Perfect. This has been really, really informative. We've got a few minutes left. I want to ask you, Dr. Billups, you touched on one of the stigmas that we've got to get over as Black men, and that's the digital rectal exam. But I'm also hearing you say that even after a surgical intervention, there is an expectation that you can go on to have a satisfying sexual life ahead of you. I know that's a real concern by a lot of men.
Yes.
Is that an accurate assumption?
There is. I mean, we are. There's a lot that we can do to help you. If you have the erectile dysfunction, incontinence too. But I'll speak more to erectile dysfunction. And honestly, it starts with really having an honest assessment of where you are before the surgery, because that really guides me. This is a lot of what I do is to see men. And if I'm fortunate, I really want to get you before the surgery so I can see where you are. Then we can talk about things like optimizing your lifestyle, and I can run through you. Here are the different treatment options that you have. Here's what may work. Here's what may not work. It'll depend on what kind of surgery. If your surgeon can spare the nerves, which we're usually very good at, depending on how much, there are a lot of different factors that go into it. But I would say that your statement is fair. We can address that issue. I mean, and when I tell people that some of the guys, because men, as you know, can be quite stubborn, but I tell them, well, if you're dead, it doesn't matter what kind. You're not going to get an erection, right? So if you're dead of the cancer, you're not. Erection doesn't matter. So let's put it in perspective.
That's true.
Okay, thank you. And I'm going to ask one more question. I'm going to have one more question that's come in a few times, and I just caught it. So I apologize, I missed it earlier, but it's come up a number of times. So I want to make sure Dr. Billups has a chance to address it. And that is the question around which surgical intervention has the best possible outcomes. Is that too broad of a question, Dr.
Well,
Billups?
it's kind of a trick question from the standpoint of outcomes. To me, really depend on what the surgeon's experience. So you can look at in the literature, and you can look at the robotic, and they'll have outstanding outcomes. But you can look at people that do, especially this kind of modified open, that have great outcomes. So honestly, I think either of those routes have good outcomes, but it is surgeon dependent and experience. I mean, and I think Robert's kind of alluded to that before.
Yeah, and a lot of that has to do with the condition of the person prior to treatment
Yes.
anyway.
Yep.
Because you can have somebody who's the surgery goes very well, but they may have some other medical issues that contribute, or the radiation treatment may go well. The proton
Yep.
beam is getting to be popular now. You see more and more of that popping up, but your outcome is not always. You can treat the cancer, but the outcome can be attributed to a lot of other things. So I've seen good outcomes with the robot. I've seen bad outcomes with the robot. I've seen good outcomes with radiation. I've seen bad outcomes with radiation. So, and when we go to our support group, we see people who had cyberknife, everything, and they're just good and bad all the way around. You just have to, when you're diagnosed, you just have to make a choice and do your research on what you feel comfortable with.
But that's a great point, Rob. And that's something every guy has control of too, right? I mean,
Yeah.
trying to optimize your own health. And you're right. It doesn't matter what treatment or what you do. That's critical. That's a great point.
In the final 4 minutes we have left, the internet is a sea of information. Do either of you have recommendations on credible information where people who want to learn more about prostate cancer can go?
There's an organization I work with out of Boston, a guy named Thomas Farrington. He runs an operation called FIN, Prostate Health Education Network. He's geared specifically to educating Black men about prostate cancer. He's like a 20-year survivor,
Yeah.
and he started this organization because he realized that a lot of black men were not being given the information they needed. Um,
Right.
and that's been a great organization for Black men. You have Project Zero, is ZERO. They do a good job about
Absolutely.
they do a great job also. So those are two. And Prostate Net. That's Virgil Simmons. He's a survivor. He started that organization. So those are three organizations that really help Black men with information.
Okay. And Dr. Billups, anything from you?
I like all those sources. I would also just say with the National Medical Association urology section, we also have great information not only for providers but also for the general public about prostate cancer, focusing on African American men.
Okay. All right. Final comments. Robert and Mrs. Young, anything you want to leave our audience with regarding your journey?
I'll just tell you, no, I'll do this. If Black Health Matters wants to put my email out there for questions, I'll be free. I'll be glad to take those. So we'd be glad. I'll be glad to
I
share
hope you
any
got an
information.
unlimited plan, Brother Young. I hope you got unlimited.
Well, it's a Gmail account, so it's a Gmail account, so
Okay.
it doesn't cost me anything.
Okay. Well, thank you for being so gracious with your time. Mrs. Young?
I just want to reiterate the fact how important it is for your wife or partner to be a support system to your spouse, and vice versa. Just as important that that man allow that wife to be a support system.
Mm,
Don't close her out.
very good.
She can have
Excellent.
you.
Excellent. Dr.
She's a
Billups?
country girl. She knows how to throw a frying pan.
This has been great. I guess what I'll just kind of sum it up with is medicine has to shift to what I call first mile care as opposed to last mile care. Right now, we are a sickness kind of based, a group. We get you at the end. Everything that we've talked about, or a lot of what we talked about today, is what you can do on the first mile, which is prevention. Which is maybe not getting this problem in the first place. And if you do get something, getting on it right away. That's the shift that we all have to make. But I'm going to tell you, the secret is that's going to be a shift that has to come from That's going to be a movement among the general public.
Yeah.
So I would encourage all men to kind of get on board with that. And I'd be happy to provide my email too, if there are any questions that people didn't get answered in the chat. So
That'll be wonderful.
Yeah.
Wonderful. Well,
And
in
for the
that,
record,
we're gonna
she's been with me 37 years. So, and
All
she's
right.
put up with
Wonderful.
everything I've done. So she deserves a Congressional Medal of Honor.
Exactly. Well, listen, I want to thank each of you, Dr. Billups. Thank you so much for your clinical expertise. Brother Young, thank you so much for being vulnerable and transparent about your journey. Mrs. Young, thank you for your support and your encouragement. And I want to thank Kappa Alpha Psi for making this a part of our conclave. I want to thank the company that I work for, Janssen and Johnson & Johnson. You know, Johnson & Johnson has already committed that over the next several years, we're going to commit $100 million to try to close this health disparity gap that exists in our country. It's going to take corporations like ours. It's going to take people in the community. It's going to take physicians like Dr. Billups, but I think we can make progress, and I'll look forward to seeing the day when we don't have some of these disparities. So thank you to each of you. For those of you in the audience, this recording, I believe, will be available for 45 days. So if you want others to see or hear this information, please direct them to the link and get this information out to people. We need to.
I'd just like to thank Dr. Hernando Carter for recommending me for this.
Absolutely. Thank you very much. Thank you, all of you, and have a great day. And thanks so much for this really, really important information.
Thank you. Dr.